Hi, everybody. I'm trying to get the screen up. I don't know if you can see it or not.
I can see it, Star.
Okay.
There you go.
Well, hello. It's nice to be with you all this afternoon. Again, I'm Starlee Hetty with PX Equine Enterprises. I am the president of PX Equine Enterprises, and I'm also an EGALA advanced practitioner. PX Equine Enterprises provides EGALA model equine-assisted psychotherapy programming. We also host and provide EGALA model training and workshops. We're the home of the Unbridled Warriors Incorporated nonprofit program, which serves our military and first responders. And we've been providing EGALA model recovery program in the greater Jacksonville area since 2004. Our facility is here in Green Cove Springs, and we have 30 acres and currently have 12 horses on the property, all of which interact at different times with our clients. And we've mentioned the EGALA model a couple of times. The EGALA model stands for the Equine Assisted Growth and Learning Association. The association was born in 1999, and the founders were a mental health professional and a horse professional, and they were working with clients in a recovery program in Utah and realized they were having some very unique things happen when their clients were interacting with the horses. They began training, and at this time, the EGALA model is a structure for conducting equine-assisted psychotherapy and equine-assisted learning. That structure is pretty important and pretty unique to the EGALA model. The EGALA model believes that clients can find their answers, that they have the potential to change and grow and be productive. So it is a solution focused, not in solution focused as a theory, but solution focused in that we really do believe that clients do have their own answers, provided the opportunity and the support necessary. The EGALA model requires a team approach. It requires that there is a therapist. That therapist must be able to clinically provide services independently in their country, region, or state. It requires an equine specialist. An equine specialist is not just anyone who's had a horse. It's someone who's had the kind of hours and long lifetime learning so that they can understand equine behavior, herd behavior, and equine psychotherapy as well when it applies to our clients. And of course, it involves the horses. There's a strong code of ethics involved in the EGALA model. It's a requirement as an EGALA practitioner to sign and abide by the EGALA code of ethics, as well as to maintain our own professional designation. So for myself, I'm EGALA certified as an advanced practitioner, and I'm a professional both on the equine side and in the therapeutic side. So EGALA requires that I maintain my mental health professional standards, that I am governed by a body that has a code of ethics on that side, and it also requires that I maintain a standard of ethics and a standard of professionalism as an equine professional. Now, not all EGALA practitioners are both as I am. Many are either a therapist or a mental health professional or a horse professional. What the EGALA model does is teach the two to work together. And just to clarify that even though I am both an equine professional and a mental health professional, in the EGALA model, I will still work within a team approach so that at no time am I trying to manage both of those professional entities of the practice on my own. One of the other unique things in the world of the horse area is that the EGALA model focuses on the ground. Participants and clients do not come out and learn to ride horses. Now, I have spent years and years being a horse professional, and I believe that horses are therapeutic. However, the idea that I would teach someone to ride and that would provide therapy for them is not a realistic one. The horses relate based on ground activities. So our clients come and interact with the horses on the ground. Even if clients come and are somewhat confused by the idea that they're going to ride, we straighten that out and we let them know that the horses are actually going to relate to them on kind of a one-on-one basis on the ground. So why choose EGALA? It has professionalism and credibility. As a worldwide organization, EGALA is the global standard for equine-assisted psychotherapy and personal development. It's a nonprofit with over 4,500 members providing services in 50 countries around the world and committed to setting the standard for excellence and professionalism in how horses and people work together to improve lives. EGALA is the only organization I know of that has that kind of a worldwide basis. A lot of people ask us, why horses? Well, one of the first things that happens is not everybody's been around horses, and they can be very large and intimidating. They rely on a social structure and communication to stay safe in the world. They actually came into this world with long legs, ready to run, and a heightened sense of communication and awareness. They don't come into the world with any weapons. They don't have sharp teeth. They don't have sharp claws. And because of that, they depend on each other, their social structure, and that heightened awareness to stay safe. As prey animals in a world of predators, that is a critical thing to have developed, is that sense of self and nonverbal communication. We're predators in the world, and so horses look at us, and although they've been domesticated and for hundreds of years have shared our lives, they still look at us with a knowledge that they need to be hyper aware of what's happening with us because it may pertain to their well-being. They continually explore social role and responsibilities in their herds as well as with humans. It's not a decision that they make based on the past. It's a decision that they make based on today. So if a client comes out and deals with a horse one day and they're angry and frustrated and the horse chooses not to be with them, it doesn't mean that that same horse might not be standing right next to them the next session, because the horse will assess the client based on how they are behaving today, what's happening between them today, and they don't hold a grudge about what may have happened last time. They continue to interact with us. As we change our behavior, they reciprocate with changing behavior in their interactions or relationships with us. Equine experiential work and recovery are such a beautiful fit. We've been doing this here at PX Equine again in this area since 2004, and it just provides such an opportunity to work with our clients in a different way that I think that you'll be surprised and enlightened. Because there's an action and understanding component to recovery, this is a good fit. Okay, so often our clients are in recovery and in a supportive world, meetings, therapy, and the rest of the world may seem unforgiving. So while they may have gained understanding about their recovery and that process and what to do with it, sometimes taking action in that area when things change or when they hit a roadblock or when frustration rises can be very difficult. Everything in the arena leads to the combination of action and understanding when they're working with the horses. So they can't really separate them apart into, you know, I'm not using or I'm not engaged in my addictive behaviors because I'm in this different environment, or I understand but I'm not sure what to do about it. Everything has to come together out here where they're dealing with the horses. So the equine experiential work is supported by reflection, analysis, and synthesis. So the reflection may happen in the form of questions during the time that they're here, and it may happen in the form of discussions that they may have later. So there are times that the experience is so profound and a client is in the middle of an experience that we hesitate to engage verbally during that time with the horses. So often the reflection and the analysis and the synthesis comes later, and it may come at the aid of their recovery programming outside of PX Equine. It may come with discussions with others. And I'll try and give you some examples of such things. We had a young man who came out and was utilizing substances quite heavily. He was having panic attacks during his job. He happened to be a long-haul truck driver. And he was drinking very heavily, and the panic attacks were getting worse. So he was pulled off the job and referred to treatment. So when he came out here, one of the first things that happens is he hadn't had a resistance built up in his mind to being at a barn. He had a very real resistance to recovery programs in general, but there's something about being at a barn, being out in the open around animals that didn't feel the same, so he was a little more willing to engage. At that time, he actually was in a program and came out here individually on his own. So we put him in with a horse that actually suffers from anxiety as well. And his job became, without him realizing it, to treatment plan for the horse who had anxiety. So what he found himself doing was staying with this horse when this horse got frightened, when the horse and his muscles would get tight. This young truck driver would stay with the horse and breathe. And at one point, the horse actually just took a really deep breath during the middle of one of these nervous times and expelled a long breath. And our young man expressed to us that that was a signal breath, that the horse was letting him know that they were okay and that they could live through this. That was the first time that young man believed that he could live through an anxiety attack. So in the past, he had been calling 911 every time from the road, from his home, because he truly thought he was dying, and then he would abuse substances immediately afterwards. So when he was able to share with this horse and tell this horse verbally, he's talking to the horse and telling him, you're going to survive this, you're going to be okay. He talked about not understanding how the horse could be so frightened when there wasn't anything real to be afraid of. So you can start to hear the metaphors and the corresponding actions. As he treatment planned for this horse, he also treatment planned for himself. So that reflection and analysis was happening on one level, and yet in a personal level, he still wasn't quite there. That actually happened later. As he reached out to resources within his own family, he started to call an uncle who had known horses. And often one of the difficult things with our clients is to get them to reconnect with family relationships, to utilize resources. And in those phone calls, this young man started to do that. Needless to say, he actually worked through his panic attacks and became quite proficient at breathing exercises and thought changing and all of those things that we hoped for him. And he did this in walking through the horse's anxiety when things would frighten it. So equine interactions require that the participant takes initiative, makes decisions, and is accountable. It's horses and humans together actively engaged in problem solving, communicating, and exploring responsibility. The critical thing is that the feedback is here and now. The horses will let you know immediately how they're experiencing you and what they think they need to do about whether or not they can be with the person or not. So the horses become metaphors as well as being real-life interaction. Recovery means practicing new or unused skills. The words that they say may not matter to the horse, but honest, congruent verbal interactions between our participants and the horses are the basis of change. These interactions allow participants to practice new problem-solving skills, attempt uncomfortable communication, work through frustration, confront fear, and find out how it feels to behave differently. Our horses are real, the interactions are real, and it's real-time practice for challenges that our participants face when they're confronting the reality of addiction and recovery. Our recovery arena here at PX Equine really does have a horse in it. We have multiple sizes, multiple shapes, multiple personalities and breeds. This allows that opportunity for so many different personalities and representations from the horse world to become metaphors for the client, to become rich interactions with personal meaning. And it's just a critical piece, I think, to have those horses in the arena. So what does the horse really do in the arena? Okay, horses, again, they know when we're grounded and focused and being real, and they know immediately when we're not, even when we're not sure of it ourselves. They understand that who we are in the moment may not be who we are tomorrow, but they expect honesty in the interactions with us. They're forgiving, and they will change their way of being if you change. Working with horses provides metaphors for life challenges of recovery every day here at PX Equine Enterprises. When an individual can deal with a 600 to 1,200 pound animal, and it requires them to focus, solve problems, and accept immediate and honest feedback, it's a powerful experience in a real-time practice arena that your clients may not get while they're still having the support of a recovery program. Oftentimes they go home and they hit roadblocks in a hard, unforgiving world, and recovery can go off track. If we can be with them when they hit those frustrations in the arena, if we can allow them to have that time to reflect and analyze and to synthesize while they're still in a recovery program, and while we can still be there to support them, they get to practice and find out what it feels like to behave differently in the real world. So the horses in their recovery arena out here at PX Equine Enterprises is a step between recovery and the real world. It is that practice step that we often don't get. Linda Myers is the owner and the founder of Stone Fox Farm in Ohio. She's been a recovery counselor for many years, and I met her through EGALA in 2001. In 2004, their recovery program at Stone Fox Farm in Ohio assisted in reducing the recidivism rate for juveniles with addiction charges in the juvenile courts from 60% to 16%. Less than 16% of the juveniles that completed the EGALA model program returned to court. This program has been ongoing since that time and continues to have those kinds of results, and has dramatically changed the way the juvenile court handles addiction and recovery issues in their county. Those are just some of the research that is out there on using the EGALA model with recovery. PX Equine Enterprises has used the YOQ measure, and it measures 6 subscales: interpersonal distress, somatics, interpersonal relations, social problems, behavioral dysfunction, and critical items. Critical items are where abuse, addiction, those issues are listed. We administered the pre, mid, and post measures, and all 6 subscales showed a decrease in symptomology over the course of 6 2-hour sessions. There's a significant difference in interpersonal distress from initial assessment to final assessment, and 75% of the pilot study participants had YOQ scores at the last session that were compatible with a normal range of symptoms. That's pretty significant for our youth with addictions and recovery issues to test in the normal range. One of the things that happens, and that often shows up, is that our folks who are in the middle of recovery have been altered or changed the way things have happened and how their coping skills have done, and so they may not have the social skills or the recovery skills that a person who hasn't abused substances or isn't in the middle of recovery has experienced. So having this assessment show that their testing came back at the level of normal after 6 sessions was a very interesting finding. You have on your screen the scores from an individual client. This is a case study of a 45-year-old woman who self-referred for personal growth to our program out here. Now, early in the intake, we realized that personal development and personal growth were actually her goals. However, she was in recovery and had a history of substance and alcohol dependency. She also let us know that she was in the middle of lifestyle transitions, going back to school. This is a young woman who was working, was separated from her husband, back in school, and seemed to be quite on top of things, but she said she could feel her dependency and her addiction floating closer and closer. And she was afraid that she was going to lose her sobriety. So you see that her pre-scores were quite high, above the norms. And I would like to let you know a few of the things that this person actually did in the equine sessions. When she came out, we asked her to enter the arena, and there were 3 horses in the arena. We asked that she create a safe place inside the arena. What she created was the length of the arena, which are small arenas, about 60 feet, and it was 3 feet wide. So she created a path, a marked path, from one end of the arena to the other. So in relation to the space around her, the path was quite narrow. When she got that done, one of the horses continued to walk through her safe path. He would cross it and turn around and come back across it and stop in the middle of it and cross it again. So she actually went and walked with that horse to get him away from her safe path. She walked him all the way around the perimeter of the area, and she identified him as authority. Now, at this point, we're observing and paying attention to what kinds of metaphors may possibly be there and what kinds of things the client identifies. So this is a male horse, and she's labeled him authority. Then she went and proceeded to get another horse, which she named education. She took the other horse, the education horse, down her narrow path with her. Now, the education horse was female. During this time, the authority horse began to cross her path again. She yelled at him. She told him to get out of her path. And in the meantime, education stopped. So her education horse stopped in the middle of her path as she dealt with authority again. So as she moved authority again, authority didn't refuse to move, but she had to physically move authority out of her path. When she went back to education, she stacked a series of steps or items in front of education in the path. And she verbalized and said, education needs to climb the steps. Well, the education horse just stood still. It didn't do anything. It didn't step onto the steps that blocked its path. It didn't try to move. So the client stepped into the steps for education and said she would try again next session to get education to move through the steps. So as this client was getting ready to leave, we just asked about the patterns of behavior we've seen. She stated that she thought she'd created a safe space and that education, she knew that education needed to be on her life path, and that there were rules regarding how to respond to authority. And the priority of education was about her personal goals and about using her resources. So that was one session with this individual. So not once did she identify her dependency or her addiction. And she did not identify the third horse in the arena. So I'm hoping that you can see some of the metaphors that have come up for this woman and some of the things that happened. Now, as we're looking into the next sessions, we're believing that it's probably important for us to make sure that the authority horse and the education horse, and perhaps the unnamed horse, are in her session the next time so that she can carry on with this if she chooses. And what often happens is clients are thinking and working on this between sessions, and they may have made some resolution about what things mean or what they want to do next time. So they don't always come in the same place with the horses when they left. But we wanted to make sure that opportunity was there. So again, she came and we put all of these horses in the area. So when she approached, her education horse literally ran in a different direction, and her authority horse walked across her path twice. She chose to work with the other horse that had not been named in the prior session. She completely walked away from her education horse and her authority horse and chose to work with this other individual. We asked that she choose a horse and choose a starting point and an ending point for where she wanted to go with that horse. Again, we're not assigning meaning. We want to see and respect what the client's meaning and the client's experience is. So she chose the third horse. It was a very large horse, and in the world of horses, quite a beautiful horse. She sat down about 12 inches in front of this horse and started handing him grass at the same time as he is picking grass with his mouth around her. Now, this session was quite unique in that the client stayed there for 40 minutes, and they moved about 6 inches in that time. She would pick grass, and she would put it under his mouth and try to get him to eat it as he was already eating grass. And he would move his head away, and she would scoot over in a direct line in front of him. Now, this is why you need a horse professional there. We have a client sitting on the ground in front of a horse. So we need to know about that horse. We need to have a physical safety understanding. So our equine specialist was quite near and very attentive during this entire time. So when we were out of time for that session, we actually asked that client, what happened out there? And she said, nothing. And the observation was made that she had lowered herself in front of the horse and tried to offer him something he could get for himself. Our client left without another word, and she missed her next session. When she did come back, we checked in again and asked her about that session. And her comment was, I had hoped you didn't notice. It was a striking physical interaction between her and the horse and a lack of interaction with the other two horses, yet she hoped we didn't notice. So there's a little reality checking going on there for us into what is she aware of and what does she believe that others notice. But what she shared about the meaning of that experience was that the big horse was the pretty one, and he was the big one, and he was the one who didn't really want anything to do with her. And she labeled him her husband. And then she shared with us that she was struggling with staying away from her old coping mechanisms of substance use because her husband, who had been abusive and who really didn't have any use for her, wanted to come back into the home. And her comment was that I have lowered myself to him to try and do things for him that he could do for himself for years and got nothing for it. And I think that this horse just showed me that. So again, things that people had been telling her for years that she wasn't able to experience the same way, she experienced with that horse. So her next sessions, when she came back, she identified a different horse who she'd labeled as not needy, not beautiful, but somebody able to interact with her on a good level, and somebody who was able to interact with her as she worked with education. And that was the horse that she dealt with. The next horse that she identified in the session after that was a horse named Addiction. So I hope that you can see through looking at this client's results and hearing a little bit about her story, how the experience of moving with the horses and interacting with the horses can be quite profound for some clients. It is just one more example of the things that we've seen happen out here on a regular basis. We have sessions where clients are focused on the 12 steps. When a client is working to move a horse that weighs so much more than them, even our big folks that come out, when a horse weighs 1,200 pounds and doesn't want to move, it's difficult for a client to get them to do it by force. Sometimes they can't get it to happen at all. And we have had them use those situations as metaphors for being powerless over their addiction. Or when horses are moving quickly and they talk about the unmanageable components to their addictions. Clients who have come out and had spiritual moments with the horses, moments where we don't know what passed between them, but we can see them still and together, and we honor that space, also fits in. We've had clients come and practice their statements to others, people in their life that have been involved in their dependency and their recovery, and the things that have went wrong. When they're making that moral inventory, sometimes being able to practice with the living being horse that does respond to your emotion, to your tone of voice, to your intent, can be very powerful. We had a young man at one point choose to tell a secret to his horse, something he hadn't verbalized yet, that he said he knew he was going to have to say out loud, but he just hadn't been able to. And he was allowed to choose a place to take the horse where we would not hear what he had to say, but we could still keep visual contact with him and manage emotional and physical safety of the area. When the participant started speaking, the horse's head went up and his ears went up and his muscle tension increased. And when the person stopped speaking, they both ran to the other end of the field. They were not connected together with ropes. They ran shoulder to shoulder. So when the client came back, the horse actually came with him. And we asked what happened when he shared his secret with the horse. And he said he didn't want to know it either, but he said he would stay with me. And he said, it's going to be okay. There's that desire sometimes to know more. There's that desire to investigate further. In times like this, we just reflect what happened with the client, allow them to stay in that experience for as long as they can. That experience for that client of being able to share what he was sure that nobody else wanted to know. And have another individual, the horse, hear it and stay with him was a powerful turning point for him. So again, there's so many examples of how this fits into our recovery work. Now, back to EGALA programs, not all programs that use horses are EGALA model. EGALA requires specific training. Okay, there's a training for equine professionals and mental health professionals in order to teach them to work together and to bring their unique disciplines together for the good of the client. That training can result in certification. And that's what you want to look for. If you're going to utilize equine programming, I would urge you to look for an EGALA certified provider so that you know that there has been the training, the certification, and there's a requirement for continuing education in the model. Just as a therapist, I must provide continuing education to stay at the top of my field. The EGALA model requires that I have 20 hours of EGALA-specific continuing education every 2 years on my certification renewal cycle. EGALA is recognized by the National Association of Alcoholism and Drug Abuse Counselors, the American Psychological Association, the American Counselors Association, the state of Florida, as well as a continuing education provider. Most states in the United States and many countries have now accepted EGALA as a provider of continuing education for mental health and substance abuse and as a certified and valid model of providing treatment. EGALA provides a professional network. So there are networking meetings regionally and in other countries. There's interaction between others. EGALA has a research committee, universities committee, education committee. There are population-specific forums and workshops such as 12-step programming. Okay, all of those are available through EGALA. PX Equine has been here again since 2004. And we are a continuing education provider for EGALA. And just this past week, we provided the Part 1 training for EGALA certification. So the Part 1 training, we usually do one here a year and one Part 2 training, which will occur in February. And in between, we have workshops for local workshops as well as workshops that draw an international group. We provide those workshops in accordance with EGALA's laws and rules so that we can maintain our status as a provider of a model that we really believe in and one that I think is a perfect fit with our recovery population. Okay, you can contact us at PX Equine Enterprises via our website at pxequine.com or by email at pxequine@aol.com. And I believe you'll see our physical address there on your screen as well. EGALA, the Equine Assisted Growth and Learning Association, is based in Utah, but as I said, it is a worldwide provider of training, certification of this type of work. So if you're interested in learning more about EGALA or finding out where the next trainings are going to be, they are worldwide. I have trained in Mexico, Canada, London, here in the United States, and most states. And the trainings all follow a protocol. We are looking for certification and proficiency so that this is a standard of care that you can count on. Okay? So I hope that this has given you a little bit to think about as far as the EGALA model and recovery processes. And I've been very happy to talk.
Thank you, Star, for giving us this opportunity to hear more about the EGALA program and more about equine therapy and working with horses. It's a very interesting modality that we know that is growing in the addiction treatment world, and we're thrilled that we've had the opportunity to hear more from you about that. I'd like to invite, if there's anyone that's got a specific question that they have for Star, to feel free to go ahead and ask any questions that you may have, and we'll be happy to triage those questions now. I have just one question as we're waiting for people to type in, Star. Do you have, in order to be working with the EGALA program, do you have to be a licensed clinician in order to go through your training?
Okay, the question is, do you have to be a licensed clinician in order to go through the training? The answer is no. So we actually have folks come through the training that are not therapists and not horse people. We have educators that come through, psych nurses, clergy, administrators, anybody that wants to understand more about it. So EGALA is certifying in the model, and they're not certifying someone as a mental health practitioner or as an equine specialist. But you are required to practice within the model, and to do that, the team must have a licensed professional therapist or mental health or addictions counselor, whatever it is for the clients that you're seeing, and a proficient and professional equine specialist as part of the team. The team can be bigger than that, but it can't be smaller than that.
Okay. Thank you. I'm trying to get to people's questions, and I'm having some difficulties finding a way to do that. Technology is never our friend. We've got several questions that are coming up. Okay, here we go. Has this model been used with people who suffer from a psychosis?
It has been used with folks who suffer from psychosis. Again, we want to make sure that the mental health provider who's part of that ECALA team is proficient in working within their area of expertise. However, I can tell you that I know firsthand for some groups we have had some high-functioning psychosis out here. One young man was quite high-functioning and still actively auditory and visually hallucinating. And it was less noticeable when he was with the horses, to the point where at one point I just asked him if he was still continuing to have hallucinations. And he said yes. And I asked how he was managing that. And he said, well, horses don't talk to me the same way. So if I hear that in my head, I know it's not really them. So they're helping me sort things out. Now, that's not my area of expertise, but it was very exciting to hear.
Okay. Do you need to own a horse, and are there treatment centers that you can work with once trained?
I would say that there need to be horses involved. There are programs on the EGALA website. They have a find a program near you. And you can actually look and see providers in the different areas of the state and the country. One of the things that happens is a therapist who's interested then needs to locate an appropriate or certified individual who is an equine specialist. And somebody has to have the horses. Now, horses don't have to be specifically trained for this model. What we really want is for the horses to be themselves. So when they're in a riding or lesson program, we teach horses to respond in a specific way when we do or say specific things. In this programming, we want the horse to be themselves. So we literally have retired horses, horses that have actively in showing careers, horses that are still untrained, and all of them become part of this program here at PX Equine.
Okay. We have another question. Is there a practicing EGALA site in Brevard County, Florida?
I believe so. I can't tell you specifics, but I believe we do have a Brevard County program. And again, if you go to egala.org and look on Find a Program under Florida, I believe they'll be listed.
Okay. How much info is given to the client about the herd instinct of the horse, or is that even necessary?
I don't believe it's necessary. Again, we aren't looking for the clients to come in and learn horsemanship. So if there's a clinical purpose for giving the client information, then that becomes part of the treatment plan. But that isn't always necessary. So it's one of those yes, no, and maybe questions. The information given about the horses needs to be given specifically as it pertains to what's going on with the client and where your treatment plan is going. In general, clients don't come in and we don't teach them about the horses.
Okay. The only other question we have is there a waiting time to get an appointment in order to do the EGALA program or to do the equine program at PX Equine?
Of course, scheduling changes day by day. We really encourage somebody who's going through recovery to be part of a recovery network such as Lakeview or others, and to also participate in Equine. If we have an individual such as the young woman we used for the case study who is already on their own and in recovery and still wanting some additional work, we can certainly accommodate that.
Very good. I think those are all of our questions that we have. Again, on behalf of Lakeview Health, we want to thank Starlee for her time today, and for those of you that took the time this afternoon to be a part of this webinar series. We will be kicking off January's webinar with a family-based programming with Ward Blanchard and Christina Blanchard from Charlotte, North Carolina. Stay tuned, more information to come on that. On behalf of Lakeview, we want to wish you all a happy holidays, and we look forward to reconnecting again in January. Thank you, Star.
Thank you.